my name is Catherine Nippers, and I'm here to talk to you about the neurological system and the geriatric patient. My objectives here are to compare and contrast the normal and abnormal changes in the neurological system of the geriatric patient, to perform a simple neurological assessment on the geriatric patient, and to distinguish between delirium and dementia. This is just an outline of the central nervous system and the peripheral nervous system, the autonomic nervous system. The central nervous system consists of the brain and spinal cord. The peripheral nervous system consists of the cranial and spinal nerves. The autonomic nervous system is made up of the sympathetic and parasympathetic nervous systems. The sympathetic nervous system is more concerned with the flight or fight response, and the parasympathetic nervous system is more concerned with the conservation of energy, while the sympathetic nervous system is concerned with the mobilization of energy. This slide just illustrates some points about the neurological system and aging. We have various changes related to aging that can affect cognition. We have many changes in the number of neurons, of the cerebral and peripheral neurons. We have loss and remodeling of synapses. Another thing that's affected is the speed of cognition. Another thing that we see change in the older adult is the deep tendon reflexes. There's a change in sensation of pain, vibration, and touch. There's also change in nerve conduction velocity and thermoregulation. So the patient may have issues regulating their body temperature. These are two common disease processes of the older adult's neurological system. We have dementia and delirium. They're often confused with one another, but I'm going to illustrate the differences in the next couple slides. Dementia is a chronic neurodegenerative disease. They have many different forms. A couple of the forms I'm mentioning here are Alzheimer's disease, vascular dementia, and dementia with Lewy bodies. Alzheimer's disease is the most common. It's characterized by neurofibrillary plaques or tangles. These tangles cause many different changes in the neurological condition of the patient. It can cause the patient to have personality changes. It can cause them to have memory loss. It can cause them to forget how to do activities of daily living. It can also cause them to have a deterioration of their language as well. Delirium is pretty different from dementia. This often develops over a short period of time. It's more than likely caused by an underlying medical condition. It could be caused by another brain condition. It could be caused by infection, dehydration, malnutrition, or any other number of different things. We have the symptoms of delirium. These include lethargy, combativeness, hallucinations, and sleep cycle disturbances. This slide just illustrates your basic neurological assessment. We have here that it's performed as part of your typical head-to-toe assessment. You assess the patient's various neurological components. You assess their orientation to person, place, time, and situation. You observe for any changes in their extremities, any changes in muscle tone, or any changes in their abnormal posturing or normal posturing. We also use a pen light to assess pupil size, symmetry, and reaction to light. Also, in the elderly, we should always include fall risk. We should include a gait assessment and an assessment of their balance, because falls are a very important thing to address in the elderly population. Another thing here we use to assess the neurological state of the patient is the Glasgow Coma Scale, and I'll talk more about that on the next slide. The Glasgow Coma Scale, it just consists of these various little segments. You assess the patient's eye-opening response, verbal response, and the motor response of the patient, and you give them each a number, and you add the numbers up, and it gives you your result. It's just a simple thing to use to assess the neurological status of your patient. These are just some simple nursing care strategies for the elder adult. The main one that I talked about earlier with fall prevention strategies. It's very important to assess the elderly patient for falls because they are very common, unfortunately. We can do a lot of things to help prevent falls. If the patient's going home, we can provide them with a night light to help with visibility during nighttime as they are getting up. Another thing we can do to help them is give them non-skid socks when they walk around in the home to help them from falling. Guardrails in the bathroom can help out as well. Another thing to help treat the patient with any kind of neurological issues is to identify and treat the cause of delirium. And so the resolution of that condition also obviously helps the neurological status of the patient. Another thing that's more specific, during surgery, they can use various methods to keep the patient's temperature regulated since the older adult has issues with thermoregulation. This can include warmed IV fluids, temperature-controlled blankets, things like that to help the patient's thermoregulation. Another thing, intellectual stimulation is very important to the elder adult. You can provide them with puzzles or books or word searches, crossword puzzles, Sudoku, anything to kind of help stimulate their brain activity and improve their cognitive functioning as they get older. Okay, that's about it. If there's no questions at this time, I'm going to give you guys a quiz and let me know if you have any questions, and thank you for listening. I hope you'll have a good night.